Jordan, when you are ready, feel free to...
Hi, I'm Jordan Tenenbaum, and for my senior seminar project, I interned with an allergist. I bet everyone in the room either knows someone or personally has allergies. Now think about how it affects their lives, how miserable they can be. You didn't just wake up knowing that you had allergies. You had to go to a certain doctor, and this doctor is an allergist. An allergist's responsibilities are to test for allergies, diagnose the allergies, and then treat them with medications. For my project, I did an 80-hour internship at 2 locations, one being Buckeye Allergy at the Dublin location and at the Cleveland Avenue location, and also once a week at Nationwide Children's Hospital. In addition, I did 20 research hours about allergy. My on-site advisor is Dr. Friedman, and he's an allergist at Buckeye Allergy, and he is also known for being a teacher of allergy. And while I was there, I saw others that were also learning from him. I chose this project because I really love sciences, and it's one of my strongest subjects in school. And also what interests me and what kind of brought me to allergy is my grandfather was a very famous allergist. And what's really cool about that is that my grandpa and Dr. Friedman worked together for a year. And I thought it'd be cool if I kind of went in my grandfather's footsteps. Another thing is that I wanted to understand allergy and see if I wanted to maybe go into allergy in medical school, because I'm really interested in going to medical school. Or maybe this will tell me if I want to go to a different sort of medical school, or go into a different field of medicine. And I'm also just interested in how an allergist diagnoses patients, because it's pretty cool how there are certain ways to help other people. So for this internship, I did about 8 hours a day for 11 days, for 2 half days. And I would arrive at 8 in the morning at Buckeye Allergy. And first, I would go in his office and we'd plan for the next days. So if a new patient was going to be arriving within the next several days, most likely they were going to need an allergy test. So he would write scripts for that. And then once patients started coming in around 8:15, we would first go into the first patient's room. And a very important part of being a doctor is being able to socialize with the patients. And that's what really makes a doctor kind of like well-known and a good reputation. So first, for about 10 minutes, we would talk to the patient and ask them how their summer was and see how they were doing. And then finally, we'd start to talk about their allergies and ask them why they were here and what brought them to the allergist. And then, usually for a first-time patient, we would order an allergy test because we want to know what they're allergic to, because that's why they're here. And then shortly after, we would leave the room, and the nurse would come back in while we were doing the same thing for other patients. And the nurse would then give a skin prick allergy test, which is where they basically have extracts of common allergens and put into the person's back. And then 15 minutes later, because that's how long it takes for the allergy test to react with the patient's back, we'd go back in and examine the back. And then before we'd exit, we would prescribe the patient with medications that would be most suitable for their problems. My favorite situation throughout the whole internship was probably examining a very interesting patient, as Dr. Friedman likes to call it, because it's very interesting for us to try to diagnose them and get them on the least amount of medications, but it's kind of hard for them because they have a lot of allergies and need to avoid a lot of stuff. And it's interesting to just examine their back because it's so like red and it's so like puffy and yeah. And then my least favorite situation was dealing with a very rude or impatient family because they pretty much disrupted the flow of our office and just the whole schedule, and it affected other patients as well. During my internship, the main learning stretch I learned was the general job of an allergist, but as well as the main job of a doctor and a doctor owning his practice, like Dr. Friedman, writing checks for, let's say, electricity or water and different stuff around the office that was necessary. The main lessons I learned about allergy consisted of the cause of allergies, how to test the allergies, how to diagnose them and treat them, and then finally I also learned just the responsibility of doctors. For my first paper I wrote, before I even started my internship, was about preliminary research, and the basics of allergy. So an allergy overall, by kind of like the main definition, is an immune intolerance, which causes someone to have an allergic reaction, pretty much where it causes a reaction that can cause them to have stuffiness or itchy, etc. And there are 3 ways to test for allergies. The main is the skin prick test, which I talked about. And then the second way is through a skin patch test. And this is for more abnormal allergies for people that are allergic to metals, like iron and copper. And this is basically where they have a patch on their back, and they need to keep it on for about 4 or 5 days. And then they would go back into the office and check it out. And if it was irritated or anything, or they thought they could have allergies, or if they thought they could be allergic to it, then they were. And the last way is through blood testing. And that is where the blood testing, they test for the IgE levels, which I'll explain later, but that can be used to predict what people are allergic to. And common allergens I also researched about include peanuts, tree nuts, grass pollen, ragweed, shellfish, etc. Also, something that surprised me a lot that I didn't know going into the internship, which I wish I would have known, is how important asthma is. And it's almost like a brother-sister relationship, where it is very important, and most patients with allergies will also have asthma. And asthma is pretty much where you have extra muscle tissue in your bronchi. And pretty much here's the easiest example to show it. Here are your like airways and air sacs, and here's the extra muscle tissue on people with asthma. And as people with asthma, let's say they're running or inducing any exercise, this muscle becomes very twitchy, and eventually it can cause it to flex and close on the airways, and then this will give the patient trouble breathing. For my second paper, I wrote a literature review about immunoglobulin E, or IgE. And IgE is an antibody, and the easiest way to explain to you guys is it's pretty much a bond from the allergen to a mast cell. So let's just pretend someone is allergic to grass pollen. The grass pollen would enter their system, and the IgE would almost detect it and bond to it, and then bond to the mast cell. And the mast cell is the evil cell that contains chemicals like histamine and leukotrienes, and these cause the swelling and the stuffiness and itchy eyes, which is why people have allergies, or the allergic reaction, pretty much. So when they actually bond together, it causes degranulation and holes inside the mast cell for the chemicals to release into the blood system, causing the allergic reaction. And the reason why some people are more allergic, or someone can have a fatal reaction, is let's say someone has a peanut, the amount of degranulation, the rate, and the amount of leukotrienes and histamines that are released is much greater, causing anaphylaxis or death and fatal reactions. For my first interview review, I interviewed with Dr. Roger Friedman again and Dr. David Hausworth. And I asked both of these people about how to treat an allergic reaction that can be fatal. And their responses, how most of you have heard of the EpiPen and Auvi-Q pen, and they're both auto-injections of epinephrine. And epinephrine is human adrenaline, and how it works is pretty much it dilates the blood cells to eventually stop anaphylaxis or a fatal reaction. And you're supposed to give the EpiPen or Auvi-Q when there's profuse vomiting, so you're allowed to vomit once, but if you vomit more than once, then you know it's harmful and can cause death. And then also if there's any trouble with breathing, so like wheezing, coughing, or any trouble breathing, so also give the EpiPen. For my second interview review, I interviewed another doctor at Buckeye Allergy named Dr. Bazaron. And I asked him all about immunotherapy, which is pretty much a fancy word for allergy shots. Allergy shots currently are the best form of treating allergies. They relieve the symptoms the best, and it is currently the only way to quote-unquote cure allergies, if you're lucky. And allergy shots are pretty much when you inject the patient with what they're allergic to, beginning at once a week, and increasing the dose very minimally. And eventually this will cause the cells to reprogram almost and ignore the allergen rather than attacking it and causing an allergic reaction. And the only 2 forms of oral immunotherapy currently are Grastek and Ragwitek, but these are for only very unique people who are only allergic to one one thing. So if you're only allergic to ragweed or you're only allergic to grass. Overall, I really enjoyed this project, and the only thing I would want to change is more hours. And some life lessons I learned from this is responsibility, time management, professionalism, and social skills. And I learned this just because I was independent, and I couldn't mess up, because if I messed up, I would affect Dr. Friedman's patients, and I really learned how to be professional about this. My future plans is I hope to attend Ohio State or Miami University, and I want to major in pre-medicine to eventually maybe become a doctor. And this is obviously relevant because allergy is a form of medicine. And I really enjoyed this internship, and I'm considering going into allergy, but I still need to test out other forms of medicine like surgery, which I already have another internship planned. I'd like to give sincere thanks to Dr. Friedman for putting up with me for 80 hours and really teaching me a lot and letting me enjoy this internship. I'd also like to thank my parents for supporting me and making sure I did all my work for this. And I'd also like to thank Dr. Friedman again, Dr. Hauswirth, and Dr. Bazaron for letting me interview them, as well as the Buckeye Allergy faculty for planning this with me and making sure it happened, and as well as Mr. Franklin, the senior team, for helping me get my papers together and eventually this presentation. Thank you. Do you have any questions?
Did you talk to your on-site? I'm just interested in any connections between prenatal nutrition and allergies?
Not really.
Okay, I just wondered. There are studies being done with what a pregnant woman is eating.
Actually, very little, but pretty much they're not really sure. They've done studies, but they're not really sure. Like to give a baby peanut butter for the mom to eat peanut butter
Right.
To stop it. And there is a small, like within like I think it's a week session of pregnancy when if they do ingest it, it can stop them from being allergic. But it's so like a small area, and it's right now it's too unknown to predict it. So I mean you can, but it can also cause them to be allergic if they do. So it's kind of like a 50-50 chance.
Okay, all right.
So that's why they don't.
very interesting.
Yeah, that's why I don't like telling people because and it can also cause them to be allergic.
Right.
What is because we were talking a little bit about this before, so like with like allergic reactions with things, what specifically about the peanut makes it so much potentially worse? Like you can't you can't die from a ragweed allergy unless you have
Right.
asthmatic complications. So what's the
So pretty much it's a peanut when it bonds to when the IgE bonds into the mast cell, just it causes a lot quicker degranulation, allowing a lot more histamine and leukotrienes to exit into the bloodstream. And if there's a lot more, it causes some to maybe go to the heart or some to go different places because it all runs in the bloodstream, and that can affect like a more main part of our system that can cause us to go into shock with it.
Did Dr. Friedman have an opinion on how like peanut allergies or general allergies are treated now amongst young people?
Well, actually, I got to observe a peanut food challenge, which is when someone's very unsensitive to peanuts, like they still are. Over the years, they've gotten better, and you can give them a small amount, increasingly, kind of like immunotherapy with allergy shots, except they eat the peanut. And but usually, unless they're really unsensitive, they don't advise that because otherwise you're going to have to give an EpiPen and it's going to cause not fun. You die. But within the next 5 years, he's pretty confident that there will be a treatment for it to cure peanut allergies.
You know, we've seen a real increase in hyperactive airway disease within inner city populations, a lot more asthma, and I'm just wondering if they've had any recent insight in that area.
Yeah, like the reason there's a lot more allergies and asthma now is because pretty much when you're born, you're either born a Th1 or Th2 helper cell, and pretty much now with all the people that were born a Th1, which produce IgE, which is the main factor to cause allergies, when the people who don't produce it, they're helper 1, now since all like measles, tuberculosis, all these harmful diseases that we give vaccinations when we're born, it pretty much causes a transfer from the Th1 to Th2, which causes IgE to be produced. and then causes more allergies and asthma. So that's why a lot more people now